Matthew Perry, thank you for joining me today again. How are you?
Hey, Brienne, I am doing absolutely wonderful, although I say that every single time I'm on the podcast. Maybe it's just, your presence makes me kind of uplifted and all that. But yeah, really doing good. I just got back from a vacation. By the time this podcast comes out, it'll probably be a little bit past that, but nonetheless, still feeling great.
Awesome. Awesome. And you're in sunny San Diego, so what can go wrong there, right?
Yeah, those been kind of interesting. We've had normally in San Diego we have the May gray, the June gloom, where it's really overcast, and I don't know what we have, July cloudy sky. Something going on here. Who knows what August has in store for us, but it's a nice change of pace.
For sure, it can be. It can be. Well, let's dive in. We wanted to talk today about chronic pain and these cycles that we end up in, I should say, and kind of just diving into why they happen and all the fun stuff around that, and what we can do about it. So, I'm just gonna let you dive in a little bit first, Matt, on kind of pain. Maybe just explain what it is, because I do know I've talked to people in the past who had told me like, oh, I didn't realize I was even in a pain cycle or an injury cycle and that sort of thing. So maybe let's talk about that first.
Yeah, it's so interesting. I feel like what's the perspective, in the seeing the trees or the forest, right? And with our own bodies, as we've talked about so many times, it's so difficult to really see the forest when we're in the trees, because it's our day to day. And when people are in that quote unquote pain cycle, which I'll elaborate on, you know, I I don't think people, can understand that they're in it. It just,
Mhm.
oh, this always hurts, and it's my life and how things are going, for however short or long amount of time. But with the pain cycle, what I've seen, just so often working with so many people in chronic pain, you know, it starts with something, right? And we know that tissues don't just, your discs don't all herniate while you work in the garden, the day before or something like that. But they'll be doing something, and that'll kind of start it. They'll feel a tweak or feel something, and they're like, okay, it's not too bad, but concerning. And then a week goes by and it's not getting better, and then you know they start maybe pulling away from some of the activities they do in daily life, because it starts or it's persistent, or it's hurting more, or at least not getting better. And then at some point, you know they find that these other issues start happening, and whether let's say they tweak their back, and now all of a sudden their hips sore, and then all of a sudden they're getting kind of muscle spasms in their ribs, and it kind of snowballs, right? And from my opinion, what that is a huge ramping up of what we call the sympathetic nervous system, and that's our fight or flight response, of course, for everyone listening. And that sympathetic nervous system is something else. It's great when we're trying to run away from that jaguar or bull or a dinosaur, but not so great, depending on your time period. For all those listening who are being chased by dinosaurs, um, but you end up getting stuck in this ramped up, really high fight or flight state. And I think that causes all these other issues, both psychologically and physically. And it's like, man, I started with the back pain, and now I can barely move. And obviously to a lesser extent when we're in a performance situation and maybe a chronic calf strain or something like that, more debilitating when it's a chronic back issue. So we can kind of dive a little bit more into that pain cycle, but it's just this really fascinating situation that our bodies can sometimes put us in, right?
Yeah, absolutely. And to kind of piggyback on that, the other thing I see fairly often, and yes, the sympathetic part is involved, but the other thing I see fairly often is like someone has an injury that does clear up, but then maybe a month later they get another injury. And then that clears up, and a month later they get another injury. And they just kind of have one injury after another that may or may not be in the same area and not fully understand that, it's like these are probably all related and there's probably something going on with your body that's creating this.
Yeah, absolutely, absolutely. And I think we were talking on the last podcast about, whether it is the same injury, whether it's something different, our body kind of conflates the two, right? Or can conflate the two.
Mm-hmm.
And, it was on our outside calf one time and our inside calf, and you're like, oh, it's back. And to some extent that could be the case. But, I think if our body took in all of the information that we process on a daily basis, in and processed all that, we'd probably be paralyzed with information, right? So our body has to kind of pick and choose, like, okay, well, it's kind of the calf area, so I'm just going to say it's the same thing. I think that's why it's so important to, because most people are doing what they're trying to do for it, going on YouTube, going on, icing it, whatever the case is. I know it's your favorite topic. But that's why it's really important to get a professional, to check this out, because again, we can identify, oh, it seems like you're in this cycle.
Mm-hmm.
And maybe it is because you're not moving well, maybe it is related, maybe it's unrelated. But, we've already tried all this other stuff. Let's try something new and try to break that.
Yeah, absolutely. And there's something I had in mind while you were saying that.
I got a little long-winded, I'm sorry.
No, you're good. No, the something triggered a thought as you're talking, and that is that, like, a lot of these chronic pain situations that we end up in, it's not just that, like, one run or that one time you lifted that box that caused it. A lot of these are accumulations of years, decades of how your body's moving, the way you're doing things. Because the body can handle, at least from my view, the body can handle improper movements for a period of time. But then eventually it just kind of like, you know what? We need to stop doing this. I'm going to cause pain. So you actually fix me.
Absolutely. The writing on the wall is there, and our bodies are so amazing and adaptable, but it'll remind us in subtle ways, and then it'll remind us in a more, a greater way, and then it'll, it's kind of like it'll whisper at us, then it'll talk to us, then it's going to yell at us, and then it's going to scream at us. And then we finally listen, and obviously pain is one of the better motivators to get us to make a change. But yeah, it's the straw that broke the camel's back, as an analogy. It was likely never that one day we were in the garden. Car accidents, and traumatic events like that, absolutely. Things can snap, or whatever, immediately. But yeah, it's all this gradual stuff, and that's why we need to get help. Before our body is screaming at us, right? When it's just talking to us, because that's a whole different treatment pathway than later on.
Yeah,
in my opinion.
It is. I mean, you and I both know those people who, I'm sure, who have avoided getting things treated and then ended up needing surgery because nothing else was going to fix the problem at that point, because they did just ignore things for so long.
Yeah. It's the difference between a 5-visit situation and a 4-visit situation.
Mm-hmm.
Like you said, or getting something beyond repair, conservative repair. But like, again, the body's just such a fascinating thing, because like you said, it'll adapt, and it'll take it for a certain amount of time. And sometimes, I don't think every ache and pain needs to get, resolved in some, elaborate fashion. But the ones that aren't getting better need to.
Mm-hmm.
But yeah, that pain cycle is just something else, and it could be just so debilitating, and not just physically, but mentally fatiguing. I've had so many people come to us and say, like, I'm just tired of being in pain. And that's when we go a little bit less of the physical therapy route, maybe some, a little bit more into the what can we do to change people's beliefs around pain, possibly,
Hmm.
through pain education, and as I like to say, kind of turn the volume knob down on their body's reaction.
Yeah, it's while therapy is a lot of movement in that, there is a lot of just education conversations that have to be had so people really understand what's happening with their body and why it's doing what it's doing, and then why, as clinicians and coaches, why we're doing what we're doing with exercises and that sort of thing too.
Yeah, yeah, and you know, the education, component, as is, I think, the most important thing, because I think if people have the understanding of why, oh, why am I doing clamshells? Why am I doing whatever? It gives them the power back, because
Hmm.
right now they have no power, because the pain is just, taken over. So, being like, we're doing these squats because X, Y, Z,
Hmm.
because it's going to help calm your back down, or whatever the case is. I think just that little nugget is so empowering for people.
Yeah, I think that's huge. And to be honest, I think that's part of the reason people don't do the exercises they're supposed to do that were given to them by a therapist or a chiropractor, or, you name the profession, is because all these things are given, but they don't really they might not be seeing results, or they don't understand why they're even doing them. And I think if we just explained a little bit more as a profession, if we just explained a little bit more as far as why we're having you do what you're doing, I think that would help a lot with compliance.
Huge. It's absolutely huge. And with our clinic, some of that stuff's pretty measurable too, because our home exercise program app, we can track the data and all of that. And when someone like really gets it, it's kind of that aha moment. Guess what? Compliance with our home exercise program goes goes up.
Hmm.
So yeah, I think my personal experience is a great example. Back when I was playing collegiate hockey, I injured myself. I sprained my ankle. It was a pretty bad one, and I went to PT. This is obviously before PT school, and I knew about the whole kinetic chain and all that stuff. I was skipping classes. I was like doing everything I could to go to PT and like make sure I was getting better faster, because hockey was my priority. I the PT prescribed a lot of hip exercises. And again, this is before I knew about the kinetic chain and all that, but she never explained to me why we were doing hip exercises. And so I'm like, this person's not even listening to me. My ankle hurts, and she has me doing hip stuff. And again, now that I know how everything's connected, it does make some sense. But even for someone very motivated to get back to playing very quickly and rapidly, I wasn't the best student, the best in my exercises, again, because it was never fully explained.
Hmm. Yeah, explanation goes a long way.
It does. It absolutely does. So, so yeah, it's again, it's regardless of nervous system stuff, or like what is going on, maybe locus of control. It's all about empowering people and trying to do what we can to kind of, again, turn that volume knob down on the pain, or turn it up on the function, to get people going. And it's so simple. It's such a simple thing, because us as clinicians, chiropractors, whomever, we understand what we're trying to convey. We just have to convey it to the patient.
Yeah, definitely. So let's dive into that a little bit. Like, what is, so many people with pain, chronic pain, injury cycles, is like they'll go to the doctor and get pills, or they'll go to a physical therapist and they'll get some exercises, they'll get better, but then it comes back again. What's missing in the whole process of getting people out of their pain or their injury cycles?
Yeah, that's the million dollar question, and the great question. You know, I do think not only, is an education component missing about why, you're doing the exercises and all of that, but also an understanding of, hey, your body's kind of like a machine, right? And it's not totally because it can repair, but we do need that kind of that servicing and that maintenance. And I think what happens with a lot of people is, they'll go wherever, have whatever treatment, and the treatment really doesn't matter, but they'll get better, and then they'll stop everything, and fall back into their habits of how they're running, go back into their gait mechanics because it's comfortable, and we're all creatures of habit. I sure am. and and then the same thing kind of pops up, and they're not understanding that they have kind of reverted back, and maybe they reverted back 50%, not 100%. But that stuff's still underlying. So, I think a big thing is, understanding that we have to continue doing things, and hopefully it's not clamshells for the next 50 years. I keep dogging clamshells and stuff, but you know what I mean. Hopefully there's a progression in there, unless someone wants to be a professional clamsheller.
There just might be a world record for that. You never know.
Who knows? Ooh, we should check that out. But yeah, I know. I think that's kind of the thing that we miss. It's like I'm better, so I'm good, and I'm gonna stop.
Hmm.
What do you think about that missing link?
I think part of the problem, like you and I are great at assessing full body, looking at mechanics, talking to people about their habits, really figuring out like what is their body doing. I feel like it, and part of this, I'm going from what I know I was as a clinician and where I was lacking when I was out of school, as well as working with the different PTs that I did and what I saw. And I think a lot of it is PTs are great at giving exercises for whatever issues going on. Where I see that a lot of the disconnect is looking at overall movement patterns to figure out what is their body doing every single day, every single hour of their day that's contributing to this. What are they doing? How are they standing when they're doing their dishes? Like, what are these habits? Going back to habits, what are these habits that our bodies are doing every single day that aren't being addressed, that aren't being broken just by doing your exercises once a day?
Yeah, that's you know, again, a very simple concept, but so complex with at the same time. Uh, yeah, because at this, I was talking about the exercises and stuff, and like someone could do 10 minutes of exercises every day or whatever, and then move the rest of the day like crap,
Mm-hmm.
and now they're back in the injury cycle, or things regress. So yeah, I mean, that's a huge point, that a habit change in totality, with it's not just Matthew's exercises or Brienne's exercises, and then I'm picking stuff up the rest of the day how I want to. It's like, no, like this needs to be incorporated into everyday life.
Mm-hmm.
And yeah, I mean that's exactly how you foster autonomy, which I love.
Yeah, absolutely. Absolutely. And it is truly, at least in my opinion, how you break those patterns. Like you can only break a pattern if you change the habit that's creating the pattern.
Yeah. Yeah, wow, that's a very, very powerful concept about, yeah, we just have to make sure we are changing, you know, more than one aspect of somebody's life,
Mm-hmm.
and how they're moving in order to have a significant change.
Yeah,
Huge.
absolutely. Absolutely. Since you did bring it up, we haven't talked about it too much. Let's talk about the sympathetic system and how that contributes to our pain responses, being stuck in these pain cycles that we can get stuck into.
Yeah, yeah. And before I go into it, I want to say that these systems, the autonomic nervous system, is so much more complex than some of the things we're gonna dive into. and could be a whole podcast series within itself. But as far as the, simplistically, I kind of think of it as, you know, something happens and, obviously, as we said before, it's built up, but you feel it the day after. Again, I'm just going to go to gardening or something like that because I think that's very relatable to a lot of people. And, or after a big workout. And, you know, what we predictably see is muscles tense up, right? That's where trigger points and all those other kind of things can come from. And I like to equate it to, our body really tensing up. What I'm doing right now is shrugging my shoulders and flexing my muscles. And, it's your body kind of saying, oh my gosh, that hurt. What is this person going to do to me next? What is Matthew going to do to me again? Because he just deadlifted, over 300 pounds and hasn't done that in like 5 years. um, and that guarding can happen. And typically, within a week, the nervous system's like, okay, he's not going to do anything crazy to me again. I can relax. But in these pain cycles, what I see is our body is just amped up and it becomes this truly cyclical thing. It's not even a cycle. We'll call it maybe a spiral, where you, instead of recovery, you go into more pain. You go into more maybe agitation, perceived or not perceived. And the muscles stay tight. They get tighter. The body gets more guarded. That causes more compression in the area. That causes more irritation. You're more attuned to it, so you're thinking about it more. And all of these things kind of create a positive feedback loop, although it's not a good thing. But they build on each other. That's kind of my simplistic perception on the sympathetic nervous system.
No, I like that explanation. It's as far as the simplicity of it and for people to understand it, that, especially with like you do one thing, you're guarded for a bit and then it calms down. But in that pain cycle, yeah, it simply doesn't calm down and we just keep building on that. So I think that's it's simple, but helpful.
Yeah. I'd like to know kind of what, your thoughts and, maybe analogies and all of that kind of stuff on the sympathetic. Because again, it's such a complex thing. It's not just one thing; it's a multitude of things. Brain and spinal cord, right?
Absolutely, absolutely. Uh, it's one I've never really developed or thought about any good analogies for. But I think just kind of to take it a little bit further is we also have to remember that like that fight or flight system is triggered by a lot of things. So your increased stress from your job or from your kids or from your whatever family stuff is going on, lack of sleep and putting you in more of a sympathetic state with those higher cortisol levels. There's just so many things that can happen that can contribute to these issues. So I think that's another thing that is often seen is, someone has pain. It might not be too bad, but it's there. Well, then maybe they just lost their job. And all of a sudden the next week, their pain's like, it was a 5 out of 10. Now it's an 8 out of 10. And nothing really changed other than that stress level. And it's just I think it's something that is forgotten sometimes in the conversation that has to be had with people when there's no quote unquote explanation for why their pain increased. I think it's important to really dive into like what happened this past week in your life, in your, everything, to really get an understanding of, is this a pain issue or is this a something else issue creating more pain?
Yeah, I mean they call it biopsychosocial for a reason. Model of pain, right? It's not just the biological tissues at fault, but it's the psychological perceptions of that. Oh my gosh, am I going to need surgery or whatever? Then it's the social implications of that, right? Like I lost my job, and don't know how I'm going to tell my significant other about that, or whatever the case is. That could be so profound. And I guess I'm in an analogy kind of day today, but it reminds me of the situation of everyone's had one of those, like the day, quote unquote. you wake up late, you miss your meeting that was very important that you needed to get to, so your boss is going to be angry at you. You are running to work with your coffee cup, you spill the coffee on your shirt. You get to the work, the boss is scolding you. You spill mustard on your shirt during lunch. It's just one of those days. I think everyone can relate to that. And then, you finally are like, it's the end of the day. You're like, okay, I can finally relax. I just need to go to bed. And on your way to bed, you stub your toe. How much does that hurt? One stub of your toe hurts a lot. But let me just say, after a day like that, I'm telling you, that is probably, because I've been there, a 15 out of 10 pain. You might even break down a little bit and just lay on the floor for a little bit. I mean, right? And yeah, and it's not because stubbing your toe, although it hurts, was it 15 out of 10 pain. It was all the other things that happened in your day that built, into that. And so, that's a powerful thing that we need to understand. And, sometimes maybe it's better that other people, instead of go to PT, get some of the other aspects of their life under control first, and then come and see us, because there's probably going to be a greater impact, right? But the flip side of that is sometimes us getting people out of pain can ease some of those other stresses in life, right? And so it really depends person to person.
Well, and as you're talking, I know we talked about this many podcasts ago, but the things that, those things that physicians like to tell people, as far as like, this is the worst I've ever seen, and that sort of thing, like, how much can that trigger that, some of these increased pain feelings as well? Because like, you might go in there with not bad pain enough to take you to the doctor, but not crazy. And then you're told that, like, that can easily shoot someone's pain up higher.
100%. Yeah. And I don't know why, it's no reflection on the doctor community or anything, the medical doctor community. But yeah, it's like, why are we saying that? Even if it is, like, why are we putting that belief in these people's head? And because if it is truly the worst, whatever, you probably need to go to surgery immediately. And if you're not, if you're leaving that hospital or that doctor's office, it's probably not the worst in the world, the worst thing ever, first of all. But yeah, I've seen people's pain, amp up. I've seen people I couldn't help, partially because of that belief they had. I had a doctor who said their patient's back was like a chicken bone, and then did like a snapping motion with their hands. And, all he said was like, oh my gosh, it's like, I'm broken. It's like a chicken bone. So, yeah, I think, I think that's one of the biggest, and it happens in PT as well, and in the chiropractic community, I mean, everywhere. But I think that's one of the biggest disservices we can do for our patients, is put in those beliefs.
Well, even on a personal side, it can be one of the downfalls of diving into the Dr. Google spiral and just all of a sudden seeing like, okay, this is this, and then all of a sudden it can cause this. And
yeah, I mean, I've been down it. I was like, oh, like my stomach kind of hurts. What could that be? And they're saying it could be cancer. It could be
always cancer.
Yeah. Definitely cancer, or my liver needs to get resected or something like that, So we need to take all that stuff with a grain of salt. And Google is obviously trying to be helpful, but can be very, very harmful at the same time. Because people come to me with a list, like medieval, like with the scrolls, like of what they think their shoulder pain could be. From heart attack to
so true.
Yeah, it's a different world, and I think it's a world we didn't necessarily perceive when we created the internet, when we created WebMD and all of these other things. But everyone, take it with a grain of salt, and get it checked out, right? Because it could be all of those things. I mean, who knows? But we as PTs and medical doctors, I think we're typically phenomenal diagnosticians to let you know that, oh, this is something we can help. Rest assured, it's probably not a heart attack. Or hey, this is, you need to go see somebody right now, somebody else right now.
Yeah, absolutely. All right. Let's see. Where do we go next?
Oh my gosh, we can go all kinds of different places. Let's maybe turn this on its head a little bit. We were talking about the sympathetic nervous system. I'd love to hear your thoughts on the parasympathetic nervous system, and what good or potentially bad that could do, or that could
Yeah.
be.
I personally, when we talk about parasympathetic, like, it's our calming one. It takes us down from that fight or flight situation. And I think it can be really powerful when it comes to pain. How many times say you burned your hand, or you did something to yourself when you were doing yard work, like you need to go to the hospital. Like, I think we've all been there where we just take those long deep breaths, try to breathe through it, and just realize like how much your pain can calm down, how much you can get your symptoms under control just by taking some nice long deep breaths. And I think there's a lot to be said for using our breath to calm down calm down our system in general, and really activate that parasympathetic system to get pain symptoms under control, whether it's in an emergency situation or just a chronic pain situation.
Yeah, I'm in the same ballpark. Our again, I keep saying our body is just such a magnificent thing. We have these endogenous opioids in our body that are stronger than fentanyl, and we really have some unique systems in place to decrease pain naturally, and to improve tissue healing. Um, uh, I I do agree that I love utilizing breathing and some of these other techniques to really calm things down. I actually back when I was in school, it was really cool. I had an understanding of the parasympathetic nervous system, and I wanted to figure out how I could better demonstrate it besides breaths and stuff. So I went to my clinical instructor, and who's been treating longer than I've been alive. And I'm like, I want to figure out if I can cause someone to relax their hamstring muscles, who has tight hamstrings, just by breathing. And of course, he's like, yeah, sure, whatever. Kind of dismissive. He's a great mentor today, and we laugh about it. But we did just that. We had this person take certain cycles of breath for a certain amount of time and a certain ratio in to out. And we measured their hamstrings before, and then we measured their hamstrings after. And we found there was something like a 20-degree increase in their hamstrings just by breathing. And so that was very profound to me, because I'm like, okay, people who have tightness, is it because the muscle is locked up and guarded? Possibly. But is there some neural input that we could play with to, get some more extensibility in the tissues? I think so as well.
Mm-hmm.
That was kind of an N of one, at some point. I'll get that a little bit more validated, but again, it's an illustration of just how powerful our systems can be. The person didn't need Advil or muscle relaxants.
Mm-hmm. That's awesome.
Yeah, it was really unique, really cool. Me, I'm always a little bit out there. But yeah, again, kind of decreasing that sympathetic tone. We call the sympathetic system, we act like it's a bad thing. It's not a bad thing at all, because that's what gets us getting those extra couple inches on a pole vault. That's what, allows us to break through that last lap, during a marathon, or, marathon or something like that, track meet. But, we need to have that balance.
Mm-hmm.
We cannot always be in one, just like, I'm sure there's negative implications to always being in a parasympathetic state.
Yeah, and you kind of referenced it in the beginning as far as we do need that sympathetic for when we're being chased by a tiger or a dinosaur. But then it's once that threat is gone, the sympathetic should calm down. And it's just the state that we live in where we're just as very much amped up, high cortisol, high stressed state that we just aren't allowing our bodies to calm down.
Yeah, like we're, from the moment we wake up, what's the first thing we do in the morning? Typically, we check our phones, get on Facebook, see whatever bad is going on in the world. We might not perceive that as amping ourselves up, but it is,
Mm-hmm.
and then, all the stresses for the day. Oh, geez, I got to go grocery shopping. I got to get to work. I have to, all of that, again, that's filling up our cup. And then an injury actually happens, and we have no more capacity.
Yeah.
And thus it begins. This has been very, very reflective. I've liked this. This podcast has been, um, it's so different, it's so unique, but it's so important, right? Because it's not just the tissues that are torn or whatever.
Mm-hmm.
People need to really understand that.
And I think just kind of going slightly different direction, but something I think is important to bring up with this conversation is stress reactions, stress fractures, things like that. Like so many times people, it's just, well, it's because I ran too much, or it's because I run, it's from running. But we have to remember that stress is stress and the body views stress as stress. So it doesn't matter what the stress is. There was someone I talked to recently. He has a history of sacral fractures, stress fractures, and not crazy mileage increase during any of them, but one of them, I think during one of them, his wife was diagnosed with some like medical condition. And so he was dealing with that. And another, like the other one, another life stressor was going on. And like his stress fractures were really just due to increased life stress. And then combine that with the running, just that impact, and it can create injury. So I think that's another thing that we forget, that no matter what the stress is in our life, in our body, like stress is stress and it can contribute to things.
Wow. Yeah, that is very powerful. And in a situation like that, what are some of the techniques, that you implemented, to kind of help a person in that kind of situation?
Yeah, with any injury, I always want to figure out what the cause is. And if that cause is true, like not that the running, something running related wasn't contributing to it, but if someone's injuries really have just shown up when they've had high stress in their life, then at that point, it's like there's probably not a lot to do from a physical standpoint. It's more of like when we get stressed, how do we manage it? What can we do for, you know, getting that parasympathetic going better? What things can we do to help us manage the stress better in our life so we aren't getting these injuries every time we get stressed?
Yeah. Stress management. We talk about it, and it sounds, you know, obvious and all of that. When yeah, I just need to manage my stress better. But it's a lot of it is the how,
Mm-hmm.
and that's very person specific. Whether that's meditation, whether that's you know other types of physical activity.
Mm-hmm.
What are some other techniques you implement? You spoke to the breathing. Um, what other ways of stress
Yeah,
management?
I like using the breath. I like meditation if someone's willing to explore that option. I think just getting more sleep can be helpful since we're, even if you're getting enough sleep for a normal day, anytime you're more stressed from everything else, like we've all been there as far as a really stressful day at work, like we're exhausted at 7 p.m. and want to go to bed. Whether you can or can't because of your kids is debatable, but like we've all been there where we're super busy, we're super stressed, and we're exhausted. So like your body just needs more sleep during those periods, and making sure we're listening to our bodies, getting more rest, whether that's at night or whether that's taking a nap during the day if you're able to, and just really and figuring out what you can do there. Making sure your nutrition's on point, uh, can that decrease your stress levels? Probably not, but we can make sure the body has adequate fueling to heal anything that might try to happen from an injury standpoint too. So there's like, we really have to look at the whole body and really figure out what things need to be done to keep the whole body well, rather than just looking at that stress management point.
Mm. Yeah, and the nutrition, is interesting because, what do we typically do, or maybe better not do when we're stressed out? We don't eat, and definitely don't typically eat well.
Yeah.
So we're skipping our meals, or we're getting the fast food or whatever because we don't have time because we're so stressed out. And so understanding that and prepping for it, whether that's spending an extra couple hours on a Sunday night to make sure you have some adequate food for the week, those are some easy, tangible fixes to, to help your body help you.
Yeah, absolutely. And nowadays, especially if you live in any sort of big city, there's so many meal prep companies too, that if you need just a week of having your meals made for you because you're going to be crazy busy with work and the kids, then take advantage of that.
Yeah, I mean, it's easy. It's for the most part affordable, but yeah, do whatever you need to do to get over the hump, but not letting other things go, and don't sacrifice all these other things, because I'm a victim of it when I'm getting going in my day, and all of that. Eating's probably the last thing on my mind. you know Drinking water is probably the second to last thing on my mind. And so I'm illustrating a point that I do have an understanding of this, and it's still difficult for me to do. I am human, but we can. There's other things we can do.
Absolutely. Cool. Any final thoughts for today?
Oh man.
Lying down.
Yeah, pain, as always, is such a complex thing. It is multifactorial. No, it is not just in your head. Everybody who's listening, and everyone who's been told that, unfortunately. There's a psychological factor, there's also a physical factor, but it's a comprehensive thing that affects your entire body. So, everyone keep the faith and all of that, because things do get better, things will get better, and hopefully through this, I mean, we've dissected so many great things on this podcast. Make one change. Drink a little bit more water. Get that chicken breast instead of that burger, or whatever the case is. Because that's you helping yourself to heal and get better if you're in that pain cycle.
Awesome. Love it. Good way to close down.
Thank you.
So Matthew, if someone has any other questions for you, wants to contact you, I don't think we did anything today to get hate mail. Where can they find you?
Oh, we'll give it time. But no. If you want to have a conversation, please reach out. My company is AutoNest Physical Therapy, committed to your autonomy, happiness, and wellness. We're on all social media outlets. Please, give us a call, send us an email, send a DM. I'd love to have a conversation. And like always, I value alternative points of view. If you think the parasympathetic nervous system is a bad thing and should be avoided, or whatever the case is, let's have a conversation about it. Let's talk about it. I'd love to hear other alternative points of view.
Awesome. Well, thanks again for your time today. This was fun as always.
Thank you so much, Brianne. This was wonderful.